Coming up next on the Jeff Crilley Show, you'll meet an amazing doctor who is an entrepreneur and who is passionate about making surgery affordable to everyone. His journey just ahead.
Many are predicting that the worst is yet to come, which is unfortunate, said one person here. Until now, they've enjoyed the reputation of being the nation's icebox.
Watched a burglar in his home this morning by webcam.
As a journalist of over 25 years, stories are what make my world turn.
Reporting live from the Dallas newsroom tonight, Jeff Crilley, Fox 4 News.
But in 2008, I took the jump from my familiar life and started a PR firm from my home.
We're talking about anyone with a camcorder like the one I'm using becomes a television network.
We started slowly growing the company, and we now have over 100 clients, and we've branched into the world of live digital broadcasting. I now own 8 different TV studios and have a huge team, and the stories that I now get to share are sometimes the most important of my life. Life has a funny way of coming around full circle. This is the Jeff Crilley Show.
Well, almost every night when you turn on the news, you're hearing reports about the skyrocketing cost of health care. And one of the things that is very expensive, as you know, is surgery. In my studio right now is Dr. Kikkeri. He is with Hinkapin Health, and he's come up with a solution that the average person can afford. Let's talk about that. Thanks for coming on the show.
Thank you. Thank you. And the way it all started was I was I'm an anesthesiologist, and I practice pain management. And I was in my pain clinic. Once when I was in that pain clinic, one of my surgeon friends called me, "Hey, Dr. K, come to OR3. So I went to OR3, and there the surgeon was doing what's called a diagnostic laparoscopy, where he was looking into somebody's abdomen through cameras with the little holes in the belly. And he was pointing to the liver. And in the liver, there was a picture of studded diamond spots in the liver. When you see a diamond spot in the liver, that's not a very good sign. And then, unfortunately, that was metastatic colon cancer. And that was not the point. The point was that the patient who was on the other side of the ether screen, who was getting the surgery done, used to come to our surgery center, where she was getting routine, life-saving, cancer-preventing colonoscopies. This happened during Affordable Care Act, where her deductible went from $600 to $6,000. Not many of us are walking around with a disposable $6,000 income. So she stopped coming. Unfortunately, her cancer went unchecked and became a metastatic cancer, and that took her life.
Wow.
That led to bundle surgery program.
Okay, tell me what bundled surgery is.
Good question. Bundle surgery, I want to use this as an example.
Sure.
When you go to grocery store, you want to buy milk, so you buy milk. So when you walk out, and the checkout person will tell, Mr. Crilley, you bought the milk, but we don't know how much the carton is going to cost. We don't know how much the cap is going to cost. So we will bill you later. And he said, excuse me, you're going to bill for the carton and you bill for the cap? Yeah, and also we don't know how much we're going to bill. So that is the status of the surgery these days. When you have a surgery, you don't know what surgery is all about. But at the end of the surgery, you're going to go get a different bill from surgeon, surgeon's assistant, anesthesiologist, pathology, facility fee, and deductible, copay, myriads of confusing verbiage. When it can confuse an educated person, imagine what it would do to some of us who are not well-versed in the medical billing terminology. So that was one of the reasons why people put off their life-saving care. So we came up with the concept of bundled surgery, where patients, like when they go to grocery store, they buy milk. When they buy milk, they know they will not get another bill. Same concept simplified. They'll get one bill. That one bill includes surgeon's fee, surgeon's assistant fee, anesthesiologist fee, and pathology fee if there is any. And if there is any implant like knee replacement implant or shoulder implant, that everything is included. That's what it
And
is.
people appreciate transparency, don't they? I mean, we just want to be told what things cost.
Yes, ahead of time.
Absolutely. He's a serial entrepreneur because he's had many different endeavors, and one of his most successful is a surgery center. We're going to go ahead and put up the website, and as we scroll down this, tell us more about your surgery center.
Oh, the surgery center we started with my brilliant and beautiful wife of 34 years. One day we were about to do a surgery, and we were told that there was not enough spot available for to take care of elderly people. And we did not know where else to take my surgery patients from my pain clinic. So myself and my wife stumbled into a piece of land, and we decided to build a surgery center without having much experience.
And it's grown.
Yes, we started with a single specialty with orthopedics, and pain management was added on, and then subsequently we have added all specialties, including spine surgery and robotic knee replacement.
Wow.
And shoulder surgery, hip replacement.
And you have assembled a dream team. Let's go ahead and show up the page off your website that shows the other physicians. As we scroll down this, why don't you just brag about the kinds of physicians that you've attracted?
I'm really impressed with my physician team and also my entire staff. These are dedicated, caring people. And I'm one of the lucky people who was blessed to have really great people working around me. They make me look great.
Absolutely, and it's a vibe. I mean, Dr. Kikkeri has invited me to come see the surgery center because not only is it state of the art, but it's just a feeling that when you come there, you're relaxed, right? It's not a antiseptic type surgery center.
It's a real care with a human touch, where you are made to feel respected, welcome, and taken care of.
Yes. And I should tell you that he's something of a TV star. We've got some video that we're going to put up on the screen. He produces a lot of video. This is you in, I guess this is a couple of years ago, but you're just demonstrating. So I think you have the heart of a teacher, don't you?
Yes, sir. One of the reasons why I enjoyed, because that keeps my mind sharp.
Yes. Tell me the kinds of people that you're attracting into your practice.
One of the main, we're talking about the staff?
Well, no, the patients.
The patients. I'm in my pain clinic, people who need relief from her chronic suffering pain, they seek out our help. That includes even cancer patients. At our surgery center, people who are looking for affordable surgery without having to go through second mortgage, without having to go into financial ruins. And the small business owners, small and medium-sized business owners, where the healthcare cost for their employees are skyrocketing, and TPAs, benefit advisors, and some of the companies looking for their help through their navigation. These are the people who do we serve.
Tell me another success story when you think about the people that you've helped over the years.
So one of the things that really touched my heart was that just a couple of weeks ago, there was a patient who came into our surgery center, and he came on a wheelchair. He came that morning, and he was there for his total hip replacement surgery. And he was brought into the operating room. He didn't speak much. He was kind of a quiet person, and he said, I have been suffering from it for a number of years. And, everything went very smoothly, and our excellent group of nurses and our nursing director, Adam Hornback, they all went out of their way to make sure the patient was well taken care of. The surgery was done, and the patient was able to walk with the help of walkers at the end of the surgery. He came on a wheelchair.
Wow.
And the patient didn't say much. And the following morning, we get a call. We always follow up our patients after the surgery. And when they call, this is the best day of my life. I was, for the first time, was able to make a cup of coffee for my wife. A simple thing.
What I love most about this is the way your eyes glow. I mean, I can tell that obviously we all have to make a living somehow, but this is a passion for you.
Yes.
Talk about why it hits you in the heart the way it does.
Sir, this is United States of America. This is my second mother. This is my foster mother. And we are privileged to be in this country where we have so many advantages. In this country, we should not be suffering and made to go into debt because of the medical affordable, something that's easily available. We should not treat our own people with such a indiscriminate price extortion.
Sure. Well, let me ask you this, as we wrap up this segment. Do you feel like the business model is so sound and so sensible that you end up changing your industry?
So that's very kind of you, but it's a tall order. I'm a one person with a group of a very dedicated team. We can do one small thing at a time, touching one life at a time.
Wow. Thank you so much for sharing your heart and your wisdom with us. We're going to end with the website, which is nttcsurgerycenter.com. The great Dr. Kikkeri. Thanks for coming on the show.
Thank you.
That's it for now. We'll see you next time.